Hello, everybody. Is once again another time that we spend time on Indigenous Hands, the Indigenous Voices, that is brought to you by Save the Deaf and Endangered Languages Initiative. So I welcome you to this week's edition of our discussion on Indigenous Hands, the Indigenous Voices. Today, I want us to continue on the topic that we have been treating for the past 2 weeks, and which is the promotion of early language access amongst deaf children. Promoting early language access amongst deaf children. And today I'm going to be talking about early intervention program and what it means and how it is expected to work and the benefits for deaf children. Early intervention program I defined last week in my own words, but the practical aspect of it is just a program that is designed to arrest, intervene. Yoshinaga Itano et al. Was one of the earlier proponents of early intervention program. Yoshinaga Itano did a work with his colleagues in Egypt about early intervention program and found out that if a deaf child, for instance, goes through early intervention program, it will make the deaf child to be able to develop language and cognition just like his or her hearing peers. And this program is being implemented in a lot of countries. But other scholars have been able to do a lot of works to help us understand how early intervention programs should work. So let me summarize how early intervention program works. It is advised by many researchers that when a deaf child is born, or rather, when a child is born and is diagnosed of hearing loss, that child, as at the moment is he or she is diagnosed of hearing loss, should be placed under early intervention program, but not just the child, the family. So the family needs to begin to take um, um, experts advice, experts counseling, and they will be taken through a program that will prepare them on how to help that deaf child to develop communication amongst the family. So when this is to take place, the family is somewhat initiated or indoctrinated into the early intervention program to get them ready, to prepare them for the child that is not going to use her vocal cords to communicate, but her hands. So I'm going to be going through the work done by Mueller and other scholars. Mueller and other scholars in 2013 sat down and prepared what they called best practices in early family-centered early intervention program for children who are deaf and hard of hearing. And this is a kind of an international consensus statement. So it applies to every deaf community, it applies to every deaf child, it applies to any child that is diagnosed of hearing loss anytime, any day. And in this study, there are a number of practices that were discussed, how early intervention program should take place and how the practitioners in the program should behave and how they should relate to the family, to the deaf child, etc., etc. Now, the principle, the principles that we're going to be looking at today, just a few of them, are to enable us to understand what should happen, even in our indigenous deaf communities, where we do not. We can be sure that early intervention program is practiced. Of course, we know that, but in case you find yourself as an advocate in such communities, what should you do and what steps should you take? So principle one says that early intervention programs should be early and have equitable access to service. Early means the time the newborn hearing screening is has taken place, which should be as soon as a child is born. And what should follow is the program. And it says that newborn hearing screening programs are implemented following documented best practices and timeliness for follow-up. Following documented best practices and timeliness for follow-up. I think I have mentioned it in one of these discussions that is a normal thing that when a child is born, that child is being screened. When my last baby was born, she was being screened, the next day before they left the hospital, and she was screened for hearing loss, and she passed. If she didn't pass, she would have been referred for confirmatory screening. If that didn't work out positively, it could have been assessed. It could have been concluded that that child has congenital hearing loss. And when this happens, as soon as this happens, the introduction of early intervention program should take place. And the study says screening and confirmation that a child is deaf or hard of hearing will be effective to the degree that they are linked with immediate, timely, and equitable access to appropriate intervention. Now, I am not reading this study for communities and countries and states where early intervention program is already practiced, because those that are implementing early intervention program in those areas, they are aware of this. Even if they are not aware of this, the purpose of this study is not of this discussion is not to tell them or teach them their work or their job. No, I'm reading this study to give us a clue of what is expected of an early intervention program. And it is my belief that in the absence of the organized, government overseen, or government initiated early intervention program in our indigenous communities, we can still practice early intervention program. We can practice early intervention program following these best practices that were stipulated in these studies. Number 2 says that it should follow up a diagnostic service which is provided immediately upon referral and is conducted by professionals with pediatric experience. Early intervention program begins with early detection, early screening, which happens in the hospital or in any designated area. Physicians, medical practitioners are very much involved in screening babies, infants for hearing loss. When the child passes the test, kudos, the child goes home. When in the situation the child fails the test and there is a confirmatory test and the child fails it, that means the child is born with hearing loss. That means the child may likely be deaf and be a deaf person and live her life as a deaf person, communicate as a deaf person. So if this happens, that means in our indigenous community, an additional deaf person has been added. And what happens? We have someone in the community. What do we do? The next is to see how to indoctrinate this deaf child. In other words, I am proposing an informal early intervention program in our indigenous deaf communities. Number 2 principle, early intervention program should have a good family provider partnership. What does this mean? It means that as soon as the program is about to start, those who find themselves in the program, those who are supposed to work with the families of the deaf child would establish a cordial relationship. And this cordial relationship would enable each person to understand what roles they are supposed to play. For instance, the practitioner should understand that this program is for the benefit of both the child and the family. So the practitioner should endeavor to establish a good relationship. Now, this is for experts who are trained. But since I'm proposing a non-formal early intervention program for people who are working in deaf communities or people who are expected to be part of this program, what are you expected to do if you find yourself trying to mentor a deaf child or who is born in a hearing community and has no access to sign language, be you a deaf adult or sign language interpreter or special educationist or whatever, or special educator or any other person, a researcher in the deaf community, and you feel that this is part of a role you should play. There has to be a cordial relationship between you and the family, and you can do this by, first of all, acquainting yourself with the family. The non-formal early intervention service provider should endeavor to allow family and child-centered interactions between them and the family members. And so remember, before this happens, acquainting yourself with the family entails, first of all, giving the family an assurance that even though this child may lack vocal communication, that a child has a potential for manual communication, and which is what everybody should help the child. Remember, in the past two discussions, I talked about the pathetic situation of some deaf children born in hearing families whereby they are not allowed by the parents to sign or to be signed to. The parents forbid it. So at this time, one of the issues that the parents are going through is lack of information. So if you are a person with this information, by virtue possibly of some of our discussions here, or by virtue of what you've known, you should know that the first thing your work entails is to get yourself acquainted with the family and then put the family in a position of information reception. Enable the family to access information or receive information as much as you would help to make available and they could also find elsewhere. Now, the information that you should focus upon include those that center around the child, how the family eventually would come up to establishing communication with the child. The fourth principle of early intervention, best practices early intervention program, says that you should bring up the family to family, social, and environmental support.